34-year-old Shahana Jakhter first noticed a white spot above her eyebrow when she was pregnant more than a decade ago. By the time she had her baby, the discoloration had spread all over her face, chest, and hands.
I wasn't happy. You know, people say accept yourself, whatever you look like, but I try that. You know, inside it doesn't work out. I feel sad deeply.
Jakhter tried countless treatments for a skin condition known as vitiligo, including creams and liquid nitrogen, before she was eventually referred to Yale Dermatology and introduced to Dr. Brett King about 1 year ago.
I'm so happy. Actually, I'm really, really happy that finally met Dr. King.
Dr. King and his team of researchers successfully found a way to speed up the restoration of natural skin tones. Phototherapy is a common method of treatment for skin conditions, but it is a slow process. Dr. King is altering that by administering 2 treatments in tandem.
I just tried the therapy, the phototherapy, which is we are sitting here already. Yeah. And 1 month didn't came any color, but after when I started the medicine, Gelsen, then in 1 week I see a lot of freckles in my face. I said, oh my God, what is this? I never get a freckle in my face. Right. But when I see the freckles, I said, this is it. It's gonna work.
The oral medication Xeljanz prevents the body's immune system from killing pigment-making cells, while the narrowband UVB light stimulates those cells to produce the skin pigment. The combination of treatments has only been used on 2 patients, but the results have been dramatic.
Little by little, it's really blending in nicely, and I'm hoping it's gonna be like good as new, like brand new skin again.
Jakhter takes 2 pills daily and pairs that with short UV sessions twice a week. She hopes the drug is soon approved for treating vitiligo because as someone living with the disease and dealing with the emotional pain it often brings, this is life-changing.
I've been there. I go through those days. I just don't want anyone to go through that. This is the time they should have like approved the medicine, and someone should have the treatment, you know, get well.
While the progress made on treating vitiligo is promising, there is still no cure. Until one is found, Dr. King's team here at Yale New Haven will continue to work to find a course of treatment that can mitigate the disease's effects. Reporting in New Haven, Connecticut, Erica Wachter, Fox 5 News.
And joining me now, Dr. Brett King, Associate Professor of Dermatology at Yale School of Medicine. We were just talking during the story. The results, absolutely amazing.
Yeah, they really are. It's a result that would be virtually impossible to achieve in such a short time prior to this discovery.
So let's talk about this treatment, the combination of the UVB therapy and Xeljanz. Most people know Xeljanz from the commercials. It's an arthritis medication. How'd you figure out it could work in this situation?
Yeah, so a few years ago, I was aware of a mouse model, which is where a lot of our preliminary data in medicine comes from. And there was a mouse model of vitiligo that showed what we thought was happening to make white patches of skin. And based on that mouse model, I thought to use this medicine because I thought it would intervene very directly in the process. And indeed, in one person, it did. Back then.
Okay. You had been using used light therapy before, but you were explaining to me that just not quite with these dramatic results?
That's right. That's right. So historically, we've used light therapy in the treatment of vitiligo. And again, it takes, results are real mixed. It often takes a long time, and we don't get to 100% repigmentation or giving people their color back completely. And so there's a need for something else. And again, based on this mouse model, it occurred to me, boy, why don't we try to intervene very directly in the disease process? And again, 2.5 years ago, we did. After that, we didn't see a whole lot.
Okay.
And then about a year ago, I figured out that it's light plus the medicine that we need.
Tell me a little bit more about vitiligo, if you would, because I know it's not something very common, but a lot of Americans know because it's something that affected Michael Jackson, and so people are familiar with that example. But could you tell us a little bit more about the condition? Sure.
Yeah, vitiligo affects about 1% of people. It affects men and women and all races similarly. It typically appears in the first 2 decades of life, but it can appear afterwards. It's an autoimmune disease. It bears no health risks that we're aware of, except that you lose color in the skin. And so for some people, it's nothing more than embarrassing, and for other people, it's devastating.
You lead me to my next question. Just last week, CoverGirl unveiled a campaign with their first model who had vitiligo, and they're basically embracing her uniqueness. If someone is comfortable with the skin changes, is there a reason why they should or have to treat it? Could you have any other problems, or are we aware of any other health-related risks?
Yeah, no, I don't think so. I think, I think it's wonderful if people, if who you are is what you are, and that makes you happy, and you function in the world well with that, what could be better? But I think for people for whom it is injurious to their emotional state or their psychology or their social situation, then I think, it's great that medicine is coming around to effective therapies.
Yeah, it was really heartwarming in the story to see that your patient, I mean, you could see her sense of self coming back and how thankful she was.
Yeah.
It must be so rewarding for you.
It's so rewarding. It's one, just so dramatic to watch somebody who's white turn into their normal color, but it's also just, it's just like, how much fun is it to see somebody just overjoyed with their new self.
Thank you so much, Dr. Brett King, Associate Professor of Dermatology at Yale School of Medicine. Thanks for sharing your story with us.
Thank you very much for the opportunity to be here.